and welcome everyone to today's webinar. My name is Trevor. I'm the Communications Manager for the Canadian Cancer Survivor Network. Thank you everyone for attending today's webinar. It is our first of the 2024 series. If you are new to our webinar series, a little background on our group. CCSN works to connect patients, survivors, and other stakeholder groups with decision makers and the wider community to engage in discussion and to act on evidence-based best practices to alleviate the medical, emotional, financial, and social costs of cancer. To learn more, visit survivornet.ca. We would also like to acknowledge that tomorrow is World Cancer Day, a day to let everyone know how effective it is when patients and families join together to propose policy changes so more patients can become survivors. Visit our website, of course, for more details. Now, this webinar is being recorded and will be available on YouTube, and a link will be provided with the email that you registered with, along with a link to the slides provided with this presentation. And we will add a quick Q&A session at the end, but if you would like, do not hesitate to put your questions in the questions tab on the GoToWebinar menu. Now, to introduce our speaker for today, John Adams is a seasoned management consultant, patient advocate, and senior fellow at the Macdonald Laurier Institute, an Ottawa-based think tank, where he focuses on health issues. John is a member of 2 advisory committees of Health Canada, one of which that he was actually at today, the Implementation Advisory Group for the Strategy of Drugs for Rare Disorders, and the Multi-Stakeholder Steering Committee on Drug Shortages. He has volunteered since 2017 as a board chair of the Best Medicines Coalition, an alliance of 30 patient organizations in Canada. He is a former board chair of the Canadian Organization of Rare Disorders, and he worked as a newspaper reporter, chief of staff for an Ontario cabinet minister, and was elected to Toronto City Council 3 times. And so without further ado, I would like to hand it over to John for his presentation. Can or will the USA pillage the supply of prescription drugs for Canadians?
Trevor, thank you so much for the generous introduction. I also want to express my thanks to Canadian Cancer Survivors Network for this invitation to present, and in particular to my peer and colleague, Jackie Manthorpe. Thank you, Jackie, for this opportunity. So today's theme is actually picking up on a newspaper account of remarks of our federal Canadian health minister that he won't let the U.S. pillage, his words, the supply of prescription drugs for Canadians. Let's take a look behind the headlines and try and assess exactly what the risk or threat it may be. Hopefully this will be some useful background and up-to-date information for everyone in this audience. I want to tell you first a little bit about the Best Medicines Coalition. I'm principally wearing that hat today as the board chair. I'm proud to say that the Canadian Cancer Survivors Network is one of the active members of the 30-plus member organizations. We're not an organization of individuals. We're an organization of other patient support and advocacy organizations. Everybody's logo's there. Next slide is our mission statement, what we're really all about. And it's timely access to a comprehensive range of medically necessary, safe, and effective drugs and related treatments, informed by patient-driven evidence and patient-driven values, and delivered affordably and equitably to all patients in Canada. So we're opposed to the status quo, which is a postal code lottery for access to clinical care and clinical treatments. We want to see the situation for all patients everywhere in Canada improve. And next slide, a little bit more about me. I too am a patient, and I come from a family of patients. I will tell you a little bit briefly about so far this year. I have to start by saying this is a gathering of the Canadian Cancer Survivors Network. I'm a member in full standing of that community. I was diagnosed with basal cell carcinoma on the scalp, and it was successfully removed. I have precancerous conditions on the scalp, and we're doing various things to try to prevent those precancerous conditions from developing into any form of cancer. My mother was going to die of a serious heart problem when I was 9 years old, and agreed to a high-risk experiment, and thus became the first. Goes back to the 1950s. I'm older than I look. and she became the first patient in Canada to have open heart surgery and survive the procedure and come out of the operating room alive. She passed when I was 24, but she didn't pass when I was 9, thanks to innovation and that. I have a son with a rare genetic condition known as PKU, or phenylketonuria. It's not life-threatening. It's only brain-threatening. And he went into a clinical trial in the United States, and the first drug therapy for PKU doesn't work for everybody, but it works. He's very well for him. So the next time you visit Toronto, if you have a really serious problem and you dial 911, he may be first on the scene, driving one of the big red fire trucks, and be happy to save your life or rescue you, whatever your need may be. And I'm a widower, and my wife died. She had metastatic breast cancer, but as it turned out, that was the least of her problems. She also had ALS, or amyotrophic lateral sclerosis, and she also had a second neurodegenerative disease known as frontotemporal degeneration. All those except for the breast cancer, those other diagnoses came at autopsy back after she passed in 2014. So I do know something about unmet needs and the need to cut the red tape and make sure we're not cutting it lengthwise so patients get access to what they need. I am a patient myself. Next slide. There's a photograph of those are my meds, and actually that photograph is a little bit out of date. I've had to add 2 since then. I had a coronary event in March of 2023. It was not a heart attack or stroke, but it was just the onset of severe angina. I felt this fully grown elephant sitting on my chest, and I couldn't talk or move, and thankfully it abated after 3 minutes, and I had a innovative procedure to clear the 90% obstruction of the main artery supplying blood and oxygen to my heart. And that was all done within a couple of days. So I'm very thankful for advances in medical care and science and understanding. And I have recently been diagnosed with a minor onset of atrial fibrillation, so that counts. And I have only lost, I was overweight, I was morbidly obese, and I'm happy to report that I have lost 110 pounds in the last year and a half, and in part because of the drug Ozempic, but also in part my A1C was creeping up there, and I was definitely heading towards diabetes, and that's why I went on that particular drug. But so I share any concerns about threats to the supply of medicines for Canadians. And next slide, please. This is what we're really here to talk about today. I want to start by saying the big overview here is that the drug supply situation in Canada is fragile. It's fragile for 2 reasons. Number one, we're a small market. Canada represents perhaps 2%. That's all of the global market for prescription drugs. But the second reason, and even more important, is that we don't make drugs. It's only a small minority of drugs are manufactured in Canada. We are incredibly reliant upon others to make our drugs, not just the finished products, but also the building blocks to create those finished products. So that's the background. And that actually, for Canada and every Canadian who cares about this, that's actually a form of health insecurity. And I'm not sure we have fully appreciated that in the political and public policy landscape across the country. Now, there is an aggravating circumstance, the new development, drug shortages. Drug shortages are not new for those profound reasons I have indicated, and some additional reasons. And the key ingredient shortages at manufacturing and disruptions in supply chains, we saw that in the pandemic in spades, and surges in demand or reallocation, and manufacturers making decisions, usually of the older generic drugs, to discontinue. The drug shortages have become pervasive. There is a website called CanadaDrugShortages.com. It's done by a not-for-profit volunteer group, and they are tracking 1,800 medicines out of the 5,000 or so that are commonly used in Canada. And some of those shortages that are in shortage or at risk of being in shortage. And some of those shortages are temporary, but some are also critical, leaving patients and their doctors with few, if any, options. And that particular website lists 1,871 drugs as being in short supply, shortage or short supply. Next slide, please. What's happening now? Well, and next slide. Well, here's most people are aware as a New Year's present from the U.S. federal government, their administration, the Food and Drug Administration, part of their Department of Health, granted approval for the first time ever for any U.S. state to import drugs in bulk from the Canadian domestic supply of drugs. And Florida happened to be first at bat. And the Florida agency provides drugs for Medicare and Medicaid recipients. That's mainly senior citizens and poor people, but also inmates in Florida prisons and residents of facilities of local or county health departments and others. The particular list includes drugs for HIV/AIDS, diabetes, hepatitis C, mental illness. And there are at least 7 other U.S. states who are piling on and either have passed legislation and have similar submissions into the U.S. agency, the FDA, or are in the process of building their submissions and building their legislative framework. So it's not just Florida, is my point, the potential threat here. Next slide, please. All right. So the U.S. FDA did put in certain conditions and safeguards, and those are enumerated here in the slide. First of all, the imports can only be at specific points of entry so that the FDA and the U.S. border officials can have some oversight and control. They basically require, it's a 3-part system. If a state gets FDA approval, the state has to arrange for a U.S. wholesaler as their agent, and that U.S.-based wholesaler has to make arrangements with a Canadian supplier. And in the FDA rules, it's required that that Canadian supplier have what is called a drug establishment license from our very own Health Canada. That, as far as we can tell, appears to be a solid and necessary and wise requirement to reduce any freelancing in the drug supply. The U.S.-based importer is responsible for testing the drug for authenticity, degradation, and any other statutory requirements of the USA, because drugs that are imported through and exported through Canada and shipped out of Canada are not tested by anybody in the Canadian government for their quality, their safety, or their efficacy. That would have to be done by the U.S. importer, and they would have to use a qualified, identified laboratory in the United States. There are also that U.S.-based importer would be responsible for submitting data on any adverse events, serious or not, medication errors, field alerts, and other reports, and would also not be allowed to be involved in personal imports through online sellers or others. Details and we recommend that you consider, if you want further information, look at a website including canadadrugs.com for a statement of the risks and the case studies involving illegal and inappropriate online sellers of prescription drugs. So far, as we can tell, and this is new, so nobody knows for sure, the FDA requirement that the Canadian source of supply have a Canadian license from Health Canada as a drug establishment should work as an adequate safeguard. We're hopeful that it will work as an adequate safeguard, and more about that later. Next slide. Some other things are going on. Of course, this is a political issue in the U.S., boiling political environment. Governor DeSantis of Florida celebrated the FDA approval, and he's still making the claim that this is going to save in the first year $180 million by bringing in these lower cost drugs. This was a news headline in American media. Next slide, please. And okay, what about us Canadians, and how are we going to be protected? Okay, well, the Health Canada this threat has been around for a while, and Health Canada has, and both the political leadership and the administrative leadership have been taking steps. And here's the statement from the Minister of Health of Canada as soon as the FDA decision was made public. I will also give the Federal Minister of Health credit. He has personally been in touch with the his U.S. counterpart, the Secretary of Health and Human Services, to reiterate our concern and to reiterate that position that Canada stands ready to take whatever steps are necessary to stop the Florida bulk imports from causing shortages or aggravating shortages. And something unheard of before, our Canadian Health Minister has also been in touch with the U.S. ambassador at the U.S. Embassy in Ottawa to reiterate that concern. And I've actually heard from officials in the U.S. Embassy, and I'll tell you about that a little bit later. Next slide, please. Guys, now guess what? This problem of safeguarding the domestic supply of drugs is not unique to Canada. We happen to be close to the United States, so that's where we hear about it, but it's also an issue for the United Kingdom, the UK, now, particularly now that they have exited the European Union, the so-called Brexit. And so they actually have a guidance about medicines that you cannot export from the UK or that you cannot hoard. Next slide, please. And this is not just the UK. This is actually a news article this past week from India. And they wrote the export of some, they're scrambling to contain a fresh crisis, this time with drugs intended solely for the domestic market, but ending up in the international market. And so Canada's not alone in being concerned about this phenomenon. Next slide, please. What more? What more can we do to protect patients? Well, our position at the Best Medicines Coalition is that government must ensure that the regulations are sufficient to ensure that drug shortages are not worsened. There's already a problem, and we cannot let Florida or any U.S. state or the U.S. government through the FDA make things worse. Are there any gaps that need to be addressed? Well, we all need to be on alert for this, and we need to be as careful and as precise as possible about determining the risk and the potential for additional shortages. We also can ask our government of Canada, Health Canada, to continue to do a good job and to step up its efforts to communicate directly with patient communities and healthcare professionals about this new threat of aggravating drug shortages. Next slide, please. What are we doing at the Best Medicines Coalition? Well, we are, as the slide says, liaisoning with Health Canada. Health Canada has, for many years, had a long-standing advisory committee on drug shortages. It's called the multi-stakeholder steering committee on drug shortages. And they actually had a meeting earlier today to brief us. And the Best Medicines Coalition is at the table there. We're a full-fledged member of that particular Health Canada committee. And we actually are the only patient organization represented at that particular table. Drug manufacturers, both brand drug manufacturers and generic manufacturers are there. The Drug Wholesalers and Distributors Association is there, Canadian Medical Association, et cetera, and the Pharmacists Associations, et cetera, and every provincial and territorial government health department is there at that table along, and it's co-chaired by Health Canada and by a rotating co-chair from one of the provinces. And we had the briefings, and at the end of the briefing that was just ended about an hour ago, they gave us permission to share the slide deck that had been prepared for that particular presentation. And so if anyone is interested in seeing the Health Canada slide deck on this issue, the threat of the FDA Florida bulk imports, be happy to make arrangements to share the Health Canada slide deck with you. And we participate actively in those meetings as a voice of patients and the patient interest. And we work with other stakeholders also. There's an Alliance for Safe Online Pharmacies, known as ASOP Canada, and others to advocate for a really strong U.S. Government response by Health Canada and by the whole of government. We need global affairs, we need the Prime Minister's office, et cetera, all on the same page. And to the best of our knowledge, they are on the page with us. They see this as a potentially serious, aggravating problem, and they want to shut it down. The underlying cause I want to talk about in a moment, but I just want to say, in Trevor's kind invitation, I mentioned that I do some work with a think tank, Macdonald Laurier Institute, a senior fellow. That think tank was approached last week by officers of the U.S. Embassy in Ottawa, and they arranged last Friday. I and a colleague from Macdonald Laurier's had an hour and a half session with two officers from the U.S. Embassy to talk about this. And we made it very clear that it's really, I started off by making a slightly flipped comment. I said, which part of the word no are you having trouble with? The answer, the Canada's answer, and the voice of patients, the voice of people who are informed about this, and the voice of the government of Canada says, no, we're not going to let you do this. Certainly not if it's going to either cause a shortage or make a shortage worse for our existing domestic drug supply. And they took that seriously, and that door is open for further contacts directly with the U.S. Embassy and through that to the State Department in Ottawa. And next week, the U.S. Senate Health Committee, it's called Health, Education, Labor and Pensions, or HELP Committee is its acronym. They're having a hearing on drug prices, and I will be submitting a letter to that hearing, wearing my hat on behalf of the Canadian PKU and Allied Disorders nonprofit, and I will be raising the issue of there's a connection directly between drug prices and drug supplies, and please don't make things worse for your northern neighbor. I will continue to raise, because it's not the problem here, the underlying problem for the Americans is their high drug prices. They're very high drug prices in some cases. Well, Canadians didn't cause that, and Canadians don't contribute to that, with all due respect, and nor did other people. That is a unique made in America situation that calls out for Americans to be mature and responsible adults and come up with made in America solutions for their made in America issues. And keep us out of it. Thank you very much. And that's it. And the next slide is what can we all do? Okay, with that. Well, as you're doing today, pay attention about this issue unfolds. There will be other media coverage, particularly as other states submit their applications and get presumably approvals, similar to the first one for Florida. And here's your action point. Here's the takeaway message. We're all Canadians. We have federal elected representatives, members of parliament, and senators in some cases, but let me focus on the members of parliament. Every one of us is represented by a member of parliament. That member of parliament is elected and works for us. Tell your member of parliament that you support strong measures to protect Canada's fragile drug supply and ensure that patients are able to get the drugs that they need based upon their doctor's best advice. That's really important. You should you should write a letter, write an email, go to a meeting. They have constituency meetings. Go make an appointment in the constituency office and talk to the member of parliament staff and let them know that you're concerned about this, and you will not rest easy until there is proven assurance that the U.S. cannot raid our domestic drug supply for the prescriptions that we all patients need. So that's, and I want to say thank you very much to each member of the audience on behalf of the Best Medicines Coalition, and thank you especially to the Canadian Cancer Survivors Network.
Thank you very much for that presentation. That was quite amazing, and really does bring the whole issue into question, and I really do appreciate your time with us, Mr. Adams. So if you have a question at all, please put it into the questions tab in the GoToWebinar panel. I guess my initial question for you, John, would be: is there a chance that this whole thing, because it is so politically charged in nature, will just almost fizzle out per se?
Yes, I believe, this is my personal opinion, I believe there's a good chance this is going to fizzle out. I believe that there are enough guardrails in place that Canada, there's a good prospect that Canada will be able to effectively say no to Florida and to Colorado and any other state that wants to raid our medicine cabinet. The I think this is part of the foo-for-rah of the U.S. political dynamic, and this is seen, you know, let me do an analogy to something, a political stunt that Senator Bernie Sanders from Vermont did. He brought, some years ago, he brought a busload of senior citizens across the bridge at Detroit to Windsor, Ontario, and they went to a pharmacy and they bought insulin at a lower price than was available to them in the U.S. marketplace. Well, first of all, that was a political stunt, and it got some media attention. And I have a bone to pick with Senator Saunders because that really was from Canada's domestic supply. But there's one thing to bear in mind about insulin in Canada. It's a little weird. We're talking about prescription drugs here and the supply. And the real issue is that under Canadian rules, no one needs a prescription to go to a drugstore and buy insulin. So that was a stunt to get some, and I actually think that this U.S. federal law and the FDA decision is a second kind of political stunt, and the Biden administration, for their own reasons, and they're facing an election in less than a year, this November, November of this year, decided, okay, we're not going to be the bad guys and say no to the Republican governor and legislature of Florida. We're going to let Canada be the bad guy and say no to Florida, and that's all right. But this is all just this is not growing up and accepting responsibility to face the real issue, which is why are drug prices the way they are in the United States, and what can the U.S. do about the U.S.'s own problem? So I am hoping you're right, Trevor, with the premise of your question. But on the other hand, we in Canada, we have to be prudent and we have to stand on guard for thee.
Mm-hmm. Sheila asked a question: is part of your mission to also affect change in Canada regarding manufacturing at home to reduce our dependency on importing?
Thank you, Sheila, for the question. Absolutely. And then part of this is raising the awareness of patients and healthcare providers to raise awareness with our political decision makers that let me make a comparison. We taxpayers are spending billions of dollars, let me repeat that, billions of dollars on helping auto manufacturers invest in the new wave of electric batteries and electric cars. That means we have the will to make significant investments in the future of our economy and our well-being. We should be prepared to an extent we've never been in Canada to help government create incentives, reduce barriers for drug companies to make drugs in Canada, and for the building blocks of those molecules, the active pharmaceutical ingredients, which is the key building block, that more of those need to be made in Canada and not made in India or not made in China, with all due respect, right? And we have to be prepared as governments and as private insurers and as patients and as taxpayers to say that might cost us more money. But having security of supply of medically necessary prescription drugs is worth the investment. That's the policy question for Canadians and Canadian decision makers and governments to face. It's not just about electric batteries for electric powered cars.
Clark had a very good one to kind of go off this general trend that we're talking about. What happened to the large drug manufacturing base in Montreal and the GTA in the 1980s?
Much of it went away in response to international trade, in response to the desire of governments for cheap drugs. Many of our drugs and their building blocks are made in far shore countries where wages are very low and where environmental and labor conditions are not the best. Let me be diplomatic. Also, we have patent and intellectual property protections for drug developers and drug companies and researchers and innovators that are not best in the world. So we have, without thinking about the long-term consequences, created circumstances that allowed a disinvestment in domestic manufacturing capabilities. There are some exceptions, all right? I mean, it's not black and white 100% versus 0%, but the vast majority of drugs and the huge majority of the active pharmaceutical ingredients are not produced in Canada. And we need to have this is kind of a wake-up call. And we need to think about what do we need to do on intellectual property and on drug prices and on drug regulations to welcome investments, greater private investments in manufacturing capabilities in Canada. And these will have to be we're only 2% of the global market. With these investments will have to be with a view to making more drugs in Canada and shipping them out of Canada to other markets.
Yuan asks, is there a website where this info is summarized? I'd like to provide context so that I can send out a call to action to my friends. I'm assuming some of the websites that you mentioned in your presentation, but if there's also anything else that you'd like to add as well, where people can get more information.
Well, people, you're welcome to. I don't want to just go on memory here off the top of my head. You're welcome to send me an email. My business working email is john.adams@canpku.org. I would be happy to respond a little more thoughtfully with that. But I think, and some of the, I would encourage you to also take a look at the website of the Macdonald Laurier Institute, macdonaldlaurier.ca. And that's Macdonald, MAC.
Sheila asks, what can we do about the postal code lottery that limits drug availability to cancer patients in different provinces?
Well, Sheila, great question. We're having a political conversation in Canada about something called national pharmacare. All right. I think it's in the best interests of cancer and other patients in Canada to engage in that conversation and saying, is the debate over national pharmacare how is it going to address the postal code lottery for access to cancer drugs and for access to other kinds of drugs as well? The other committee at Health Canada I sit on, it has the implementation advisory group for the drugs for rare disorders, and that would include rare cancers, by the way. There is a commitment for the first time of some federal funding, $500 million a year, to assist provinces and territories with paying for drugs for rare disorders. And when that was announced, the then health minister said, he ad-libbed. He said, we went off script and said, this is about addressing the problem of the postal code lottery in terms of access to orphan drugs for rare disorders, including rare cancers. But we need to take that conversation over to the feds, principally, on the discussion about what would be the key elements of any kind of national pharmacare. Right? So that engage in the debate about national pharmacare and say, we have a postal code lottery to access to cancer drugs, not just rare drugs for rare disorders. And what will you and your party, and what will you, dear politician, do to address the problem, the serious problem of that postal code lottery for access to drugs?
Mm-hmm. A couple of comments as well. One from Clark. One problem I have today is that one cannot determine the country of origin of medications. For example, now Shoppers Loblaws meds show that they were supplied by a repackaging business they own as the only indication of country of origin.
Right. Well, we can work together to ask Health Canada to change the rules and regulations so that those product labels show country of origin. All right, that would be those companies that you've mentioned can do that because that is okay within the existing rules. And I think it's incumbent upon the rules to be changed so that informed patients, informed consumers can actually say, where did this, not just where was the medicine put together, but where was the active ingredient made? That would be the distinction I would draw attention to.
Stephen asks, do you think that the government should introduce a legislative tool in addition to the existing regulatory tool to address potential reimportation from the U.S.? In 2005, then Health Minister tabled a Bill C-83 to prohibit bulk export of drugs. And in 2006, then Opposition MP Carolyn Bennett tabled Bill C-378 to achieve the same. Both never made it into law.
Right. And ironically, Carolyn Bennett is my personal member of Parliament. Yes, you know, the Health Canada and the government of the day, the current government, have changed a regulation, but they haven't changed the law. And regulations are easier to change and easier to unchange. If it's in the statutory law, regulations are not passed by Parliament; they're approved by the cabinet in private session. The laws are approved by Parliament if they're approved in public session, right? And it's on the record. So we could make the tools in the toolbox stronger and more permanent by moving it out of the cabinet approved regulation and moving it into the parliamentary approved and parliamentary scrutinized statutory law. Good point. Thank you.
Michael says, thanks for a great presentation, John. We should also talk about the perception of drug shortages, which is another problem as it may contribute to patients hoarding drugs, which will contribute even more to shortages. We need to reassure patients essentially.
I agree. And that's really hard for a patient group to do or a coalition of patient groups to do because we don't have a line of sight into the stockpiling and warehousing and distribution things. So we can call for the drug makers and we can call for the drug wholesalers and the drug distributors to do more. But I think we actually need a bit more. Patients and individual doctors could benefit greatly from a bit more guidance and leadership from Health Canada, which oversees the drug makers and oversees the wholesalers and oversees the distributors through this mechanism called the Drug Establishment License. All right, they're the ones who have a line of sight into the actual supply chain.
Mm-hmm. All right, one more question from Clark before we wrap it up, and it's actually one that we can kind of leapfrog into you talking a little bit more about Best Medicine Coalition in itself. Could the Best Medicine Coalition set up a form of advising MPs and others of the issues you so clearly point out? There are some that address both federal and provincial issues and provide a means to communicate with elected officials.
Yes, the Best Medicine Coalition is a pretty modest organization. I'm a volunteer. I will say that. There as the board chair, we have all our board members are volunteers. We have 2 people who are not full time as our professional resource staff. So please bear that in mind. And yeah, I'm making a plea to people to take on personal and other organizations to take on some responsibility here for the outreach. I will take that back to my colleagues in Best Medicines about what we might be able to do to be a more of a hub for this kind of thing within the resources that are available to us.
Mm-hmm. Well, thank you very much, John. This has been a massive eye-opener, and also it's very comforting in a sense to know that Health Canada is not just going to let this just kind of go through, and that they have and that there's a lot of stuff going on behind the scenes to make sure that our drug supply is protected. So thank you very much for the presentation, and yeah, it was fantastic all around. So thank you very much.
You're most welcome. I just pointed out from the background, it might give you a small clue that I might not be in Canada right now, but I will be back in Canada tomorrow night. Right.
Excellent. Well, thank you very much to everyone for showing up to today's presentation. This is a series of webinars that we are going to be offering in 2024. This is the very first one. We still have to nail down some details with our other webinars, but we are very hopeful that we will have more in the month of February. If you want to keep up to date, check out our website and also check your email for our e-blasts. If you're not seeing those e-blasts in your email, check your other folders, because we do use a third-party email service, and make sure that you are subscribed to our email services and to our newsletter. And if you do subscribe, you can be in the loop about our newsletter, about what we're doing, for instance, World Cancer Day, and not to miss anything that goes on here at CCSN. And once again, all these webinars can be found throughout the year at our website at survivornet.ca/webinar, or you can go to CCSN's YouTube channel. And so with that, I'd like to say have a good evening to everyone, and we'll see you on the next one. Bye for now.